My name, again, is Robert McVeigh, and today I'm going to be presenting information about accessing community resources for patients, families, and caregivers residing in Nevada. I would first like to thank everyone for attending, and especially those people joining us remotely. As a means of introduction, I am a licensed social worker with the state of Nevada. I work here at the LouRuvo Center for Brain Health, basically with patients diagnosed with multiple sclerosis. I am a graduate of the Masters of Social Work program at the Jane Addams College of Social Work at the University of Illinois in Chicago, and I also have an MBA from DePaul University. Finding community resources that are available to patients in Nevada can sometimes be daunting, to say the least. My job is to direct patients to resources that address non-clinical, non-medical issues. Otherwise, they'd be going to the doctor, the nurse practitioner within the clinic. But these things also have a major impact on the well-being of the patient. So by providing this service, it creates a more holistic approach toward healthcare delivery, encompassing all their medical services with things that affect their general daily lives. So this also may affect their overall health. My position is funded through a grant from Gloria and Emilio Estefan. Starting at the age of 10, Gloria helped care for her younger sister Becky and her late father, Major Jose M. Ferraro, who'd been diagnosed with MS. Her mother worked during the day, went to school at night to become a school teacher in an effort to support their family. And the Estefans continue to be a major supporter of our programs here at the Cleveland Clinic, Nevada. You may be asking, what is a social worker? Before I offer some examples of community resources, I'd like to first explain the role of the social worker in this process. Social workers are employed in a variety of settings that you may have run into in your general course of life. Some work for hospitals and discharge planning, public schools working for students and their families, police departments and courts as part of investigations or ongoing court cases, social service agencies and case management, or in community activist organizations as advocates for marginalized or oppressed individuals. Social workers may work directly with clients addressing individual and family and community issues. They may work at a systems level on regulations and policy development, or as administrators or planners of large social service systems. Many social workers are generalists like myself. We use our knowledge and experience to connect clients with community resources. Based on the individual's right of self-determination, we will recommend only resources for the services that the client has identified that they need. It's really not appropriate or ethical for me to impose my own thoughts or beliefs on someone. So my first priority is to find out what an individual's needs are and then address those needs appropriately. Building on their clients' strengths and resiliency, social workers work to increase the client's capacity for problem solving and coping, to obtain needed resources, to facilitate interactions between individuals and between people and their environments, to make organizations responsible to people, and to influence social policies through advocacy. Since I do not diagnose emotional disorders or provide clinical psychotherapy, as a generalist social worker, I generally refer to individuals as my clients rather than my patients, because I'm not offering anything medical to them. You may ask, why should I use a social worker? It may save you time and energy, both which you probably have very little of, in identifying and locating community resources. Similar in concept to a support group, I may have information regarding community resources that other individuals have used and may meet your specific situation. After I've learned something about your current situation, I may be able to identify other needs that you might have or narrow down some of the types of assistance that you're eligible for. It may also be possible to identify other resources that have not yet been explored or you may not have been aware of, but you would find helpful. The best part is the last one. Because the Estefan's generous donations, my services are provided at no cost, so there's no out-of-pocket expenses or insurance issues in using our services. This, I just thought it was a cute sign to show again that about the typical resources that are being requested here in the state of Nevada. So these, I'm going to try to address resources that are available to people throughout the state. When I do get something that's only applicable to Clark County, I'll try to point that out. Some of the typical resources that are requested, one of them is home health services. Often the question revolve around, is it covered by insurance? How long can I receive it? And which agency can I use to provide it? So your doctor prescribes physical, occupational, or speech therapy, whichever is appropriate. These services are generally limited in time, in terms of duration, but may also be terminated if the therapist finds that they're no longer beneficial or medically necessary, which means they become custodial care, and in that case, they're not covered by your insurance anymore. Skilled nursing care is also available in the home and often follows a hospitalization. Generally, that's needed for things such as changing dressings after surgery, giving injections or nutrition therapy, providing a patient or caregiver with education or perform wound care. It's always important before you start receiving services like this that you verify with your insurance company who their preferred providers are to avoid any surprises or unexpected bills. And we're going to talk more about insurance in a little bit. Homemaker services generally include light housekeeping duties such as vacuuming, dusting, washing dishes, or doing laundry, but they're only intended to meet the patient's needs and not necessarily to provide a household. If there's 12 people living in the house, they really are only intended to take care of the patient's needs. They may prepare meals, do grocery shopping, help complete daily items like addressing or mailing envelopes, and if they agree to it, they may transport patients to medical appointments. There are some voucher systems available to individuals with limited income to help pay for these services for a limited time, but generally, homemakers must be paid privately if needed for an extended period of time. Requesting workplace accommodations is a very common issue for those patients with disabilities who continue to be employed. Many workplace accommodations do not cost the employer anything other than the time to implement them. Most employees can negotiate minor changes to their daily job routine, which allows them to work effectively. There's a number of excellent brochures that are available to describe how, when, and what to tell your employer about your medical condition, and how it might affect your ability to perform the duties of your job. You have specific rights under the American Disabilities Act, but some employers may choose to ignore them or just not be aware of them. In one recent instance, I had a person's immediate supervisor gave them incorrect and probably
the conference is about to end.
Okay. And possibly inappropriate suggestions about what a person could do if they couldn't complete their job assignments, and basically was told them, well, if you can't do your work, then you need to find another job. That's not really an acceptable response to an ADA work accommodation request. So they were able to go back to their employer, discuss it with them. They reviewed the job, found some things that could be changed, made some movement of supplies and resources that they needed, and made it possible for the person to continue working. There are a number of state and federal programs to assist individuals in obtaining either job or career retraining, especially if they are unable to continue in their existing or previous positions. This is especially important if a person's disability application is denied on the grounds that they may be able to do other work even if they can't perform their current duties. One of the things that they have found is that the job retraining generally does not work. In the case that they quoted, they talked about someone working in a manufacturing environment. They brought them in, they retrained them on other manufacturing positions, and they sent them back out to find a job. And it was in an environment where there are very few manufacturing jobs, so it really didn't do too much for them. So they really emphasize the use of career retraining. So they look at your skills, your assets, your abilities, your experiences, and explore possibilities of a new career where you could use those more effectively. So career retraining is probably a better option in most cases. Another thing that I get regular requests on is for home modification projects that people need to have around their home, such as grab bars, ramps, accessible showers, etc. Most people living on a fixed or limited income need some assistance. There are a couple programs out there that can help. Some programs provide someone to come in and inspect the property, let you know what modifications need to be done, and that's it. Others do that, help supply the grab bars or whatever they're going to install, and are able to find someone either as a volunteer or as a company that's willing to do the installation at a reduced rate. So the only problems with some of these resources is that I just had one client recently told me that it could be 12 to 18 months before they got to their project, just because they've got limited resources. So they have little money to spend it. When they get more donations, they do more jobs. There are several financial assistance programs that can be accessed, depending on the many qualifiers that they have and what the money will eventually be used to pay for. The funds may be available for up to 1 year at a time, or they may be just for a one-time payment. There are programs to help pay general bills that have accumulated for short-term homemaker services, rental assistance, utility bills, and to assist in making prescription drug co-payments. Many programs have an income limitation, but not all. In the case of the prescription drug co-payment assistance programs, several require that the patient not have commercial insurance because they've already negotiated a contract with Medicare or other commercial insurance programs. Because the expense of many of the medications used in the treatment of neurological diseases, some individuals have not qualified for assistance because they have to report total household income. So I've had a couple instances where even though they need the income, people are forced to give up, say, a part-time job to reduce their income so they qualify for the program. I had one individual who was concerned about marriage. She'd never been married before, had a proposal, but if she got married, you add her new spouse's income to her household income, and again, she would lose thousands of dollars in prescription assistance. So it's sort of sad that someone can't get married, for financial reasons, but I guess that's part of our existence today. Oops, I got this right. What in the world? Oh, it's going backwards. Okay. Insurance. Some of the biggest issues with medical insurance are affordability and coverage. Although one medical insurance policy may appear to be more affordable than the other, it may not be because of higher deductibles and co-payments. Even if the premiums are similar, a plan must be selected that includes your physicians and therapists that they will accept if you wish to continue seeing them without having to pay for them on a cash basis. Unfortunately, many people who have been purchasing insurance through the health exchange programs have very limited acceptance. So we have some that have big name insurance companies, but they'll call the clinic, and that's not covered. So like I say, it's very important for your primary, for anybody that you might be seeing, that you make certain before you purchase that insurance, no matter what the cost is, make certain that it has some value to you, that you can go and continue to see your doctors, your therapist that you'd want. Okay. Legal matters that people have wished to address may include creating a will and a living trust, providing for the care of minor children. It may include meeting with a financial planner, etc. There are attorneys that specialize in estate planning or elder law that can assist in these matters. The simple thing like organizing your bank account information, insurance documents, copies of birth certificates, marriage and military records, and a list of your doctor's names and medications, and putting those all together and putting them in a convenient location may save you and or family members valuable time in the future. So just taking that extra step of gathering the information is a big help. Social interaction is another issue that comes up quite a bit, especially for patients who've become more isolated due to no longer working, no longer driving so that they can visit family or friends, or just having a limited number of visitors coming to their home. It may be time to sign up for a music or art program, a card club, a local support group. Adult day health care programs are available that provide social interactions for a number of people. The advantage there is that they do generally provide transportation, lunch and snacks, games, entertainment, range of motion exercises. They generally ensure that you receive your medications during the day, and they have someone to assist you if you need assistance with toileting or other personal matters. Counseling is another area that our patients should feel comfortable utilizing. This is a perfect time to meet with a licensed clinical social worker, especially if you've never sought out counseling before. Unlike generalist, the licensed clinical social worker often specializes in one practice area, which focuses on the assessment, diagnosis, treatment, and prevention of mental illness, emotional, and other behavioral disturbances. Individual, couple, and family therapy are common treatment modalities. And here at the clinic, the sessions are generally 1 hour in length and are conducted privately in a comfortable counseling room. Similar to my position, there's no charge for counseling like this at the LouRuvo Center for Brain Health. So they're also covered by a grant. Transportation is a major issue that we have as patients become more disabled, become older. At some point in time, you may have to consider your own ability to continue driving. This may or may not be your decision, may be a family decision, but when the time comes, you can request to be reevaluated at the DMV. When it's no longer safe for you to operate your own vehicle, I often suggest that people ask their friends, family, or neighbors for rides whenever necessary, and remind them to be kind, thoughtful, and appreciative each time a ride is provided, because it's always nice as you're helping someone out to be thanked for doing that extra special thing. The next best thing to the freedom and timeliness you enjoyed while driving yourself whenever, wherever you wanted to go is through a friend. The next option is to request rides from volunteers from several organizations that exist. And again, I'm only aware of the ones that are in Clark County. I'm not certain statewide, but I believe many of them are available in different areas. But they may require you to request your ride from 1 to 10 days in advance, and they assign a priority depending on where you're going. So if it's a doctor appointment or something other than a social visit, they're going to give priority to the doctor appointment. They also may restrict the distance that they will transport you. Your next option, and in my picture, is the RTC bus. They're a vital backup system, and everyone who qualifies should have this in place just in case they need it. You call them, make an appointment to be evaluated. They come to your home, pick you up, perform their evaluation, complete the necessary paperwork at that time, and then bring you back home. When you schedule a ride, they assign a priority and try to honor the times that you have requested, but people often complain that the vehicles are loud or uncomfortable. You may have to share the bus with other passengers. They're not always on time. But again, if you have no other way of getting from one point to another and back safely, it's a really good backup system to have. The other thing that I'd mention with that is that you also need to consider, if you're moving, to verify that where you're moving to is within their service boundaries. I have had one or two individuals who moved to new apartments and only to discover that there was no bus service. And if they're not on a fixed line bus service, that same area, they don't have paratransit system service there either. So unfortunately, I'm not certain how they got out of it, but they may have gotten out of their lease just to get back, because that was their only means of transportation. I had two different couples that had both lived in their homes for over 30 years. They moved when the homes were first built. They thought now 30 years later, stores, transportation, doctor's office, banks are all built up. They've never changed the map. So there are some large areas of Clark County that are not covered by public transportation. If you live southwest, if you live up northwest especially, there's no service there. Even though the area has been developed for decades. They're also planning to reduce the number of hours that paratransit service is available. Right now in Clark County, it's 24 hours a day. And then the last picture is the limousine. Through the Estefan's donation, I do have financial resources to pay for taxi rides for MS patients to and from their appointments here at the Cleveland Clinic. They are very disappointed when that limo doesn't pull up a taxi cab. So we have not yet gone to a limousine service. So the durable medical equipment is also something that's prescribed by your doctor. It refers to any long-lasting device that is medically needed for use in your home. And that's the same thing people get sometimes confused, that I need a wheelchair because I want to go shopping, I want to go to the park, or whatever, and then they apply through Medicare. You have to first have the need within your home or they won't pay for it. So it's nice to get out, and it's appropriate to get out of your home, but just like the durable medical equipment, it has to first be needed within the confines of your home. The durable medical could be hospital beds, canes, crutches, walkers, nebulizers, blood sugar monitors, infusion pumps, or CPAP devices. It all depends on how your insurance company is set up, on how you get them, what you get, and where you get it from. Most companies follow the standard Medicare Part B, which is the medical insurance programs and standards. But again, it's something that you want to check with your insurance provider before ordering this, because like I say, you may be ordering it from the wrong provider and get stuck with the bill. Okay. Let's see. Turn too fast. Where did I go back? Okay. Excuse me. Another thing that I assist a lot of people on are for disability programs and applications for disability income. If you become disabled or no longer able to work, you may have to apply for disability payments for monthly income. The first program, the SSDI, or Social Security Disability Insurance benefits, are dependent on your age and whether you worked and accumulated Social Security credits. One of the examples I give is if you're 50 years old and become disabled, to qualify, you have to have worked a total of 7 years, 5 of them which had to be within the last 10 years. So it's an employment insurance related system. You should apply as soon as possible after you become disabled, because the process may take from 4 months to 2 years before you see any payment. To make matters worse, even if they approve you, there's still a 5-month waiting period before you receive any benefits. So you just have to wait, and then they'll pay you the back pay. They may pay you up to 12 months prior to that if you can prove that your disability occurred, but you just didn't apply at the earliest date. You can verify your eligibility and can submit your application for SSDI benefits online. They use a weighted formula to determine your benefits, which were up to $2,663 in 2015, but it may be reduced by any other type of government disability or workman's comp that you might receive. So any other type of government compensation is subtracted from that. The other form of income is the supplemental security income. It's not based on employment, it's based strictly on financial need. You cannot apply online. You do have to go make an appointment and go into your local Social Security office. Both the programs are processed and maintained by the Social Security Administration, but their funding comes from different sources. An average of 7 out of 10 of the applications are denied, so you should expect not an early response on some of your applications. Applicants can appeal and submit additional documentation. If that appeal is denied, they may have to appear before an administrative law judge and have a face-to-face submission of your claim. It may take, again, up to 2 years to be processed. If you get the SSDI approved and it's a reduced amount, you may, because your income is low, you may be able to qualify for the SSI or the income-based program. So you may be able to make up to the maximum if you qualify for both programs. I don't know why. Okay, advanced directives. Advanced directives are legal documents that allow you to spell out your decisions about end-of-life care ahead of time. They're readily available in several different formats. They can be individually prepared, or they can be individually prepared for you by an attorney. Basically, a living will gives direction to others about how you would like to be cared for if you cannot make medical decisions for yourself for any reason. A durable power of attorney for health care allows you to appoint someone to act as your agent to make medical decisions for you if you become unable to do so. Here in Nevada, these documents can be combined, but they generally like to have both of them signed so that they confer with each other. They're doubling up as confirming what your requests are. As accidents or illness can happen to anyone, everyone should have these regardless of age, because like I say, anybody can get sick, anybody can have an accident at any time. DNRs, they're the do not resuscitate, and the DNIs, do not intubate, reinforce your decision to not have these specific procedures performed, but generally are not recognized by paramedics. If you call them, they figure there's a reason you called them. They're going to do the same thing, take you to the hospital, present there, they'll honor it. But the paramedics are saying, why'd you call us if you didn't want us to do something? So they didn't come just for a visit. So for those people that have a life expectancy of less than 5 years, doctors may sign an order directing the patient's medical treatment using a POLST, or a physician order for life-sustaining treatment, which is accepted even by paramedics because it is a doctor's order. And if there is a mental health history, a standard advanced directive may be modified to include restrictions on mental health care through a PAD or a psychiatric advanced directive. So these are kind of things that you may want to take advantage of. There you go. Oh, forgot the last one. Last one is travel accommodations. We've had people, again, through the process of being isolated and becoming depressed because they're not seeing family members. They've got a bucket list of places they'd like to see, or family members that they have not seen in a long time. Eliminate travel from their lives, and we're saying you really don't need to do that. For most of you are familiar with airport travel today. You can get picked up at the curb. You can have your check-in done right there. They'll help you bring a wheelchair, take you through security, take you right to your gate. Most airlines now have accommodations where they have the aisle seats that will take you back, and in the past, people couldn't get off of them. But there's a number of airlines now that will physically help you transfer into your seat. So they'll get you on there. They reverse the process at the other end, get you off the plane, out of the airport, back to your transportation to wherever you're going. And this is not just for airline travel. You can get this on buses, trains, RVs, cruise ship travel. All these can make these accommodations. There's travel agencies that specialize in vacation rental properties or international travel where they can do similar accommodations, even if you want to travel out of the country. Okay. And this is just sort of a list of random resources that I've been requested to give information on. And again, I'm not trying to give specific things or specific resources, because depending on where you live, there may be a better place that's more convenient for you because of your transportation. I might want to direct you to a certain location rather than have you go across the state or go across the county. So we want to make certain that the resources are appropriate for you. So like I say, but there's resources available for everything that we've talked about here today. Some of the other resource requests that I've received are for low-cost vision care or for eyeglasses, in-home or mobile services, like a notary public, computer repair, auto mechanics, or weddings. I've had requests for assisting in finding or service animals. A lot of people want exercise classes that are appropriate to their situation. There's a lot of programs for food assistance or food subsidies. We've had requests for nutritional or gourmet meals on wheels. You know, some people don't want just the frozen thing that you throw in dinner. They want something delivered every day, and they want it to be nutritional. So we'll get them to that. Personal asset liquidation and organizational services are available for those who want to simplify their life by reducing the amount of their possessions. I've made referrals to companies to help them sort, organize, or dispose of personal items, as well as prepare large sets of collectibles for sale. And I've also provided it to at least 2 self-professed hoarders that had major issues with having personal possessions. So now those are most of the popular areas that patients have inquired about. As I stated earlier, the community resources are available throughout the state of Nevada, except the transportation that I addressed is a little bit more geared toward Clark County. But it's up to the individual to determine what services they need or will accept. So please do not be afraid to ask for assistance in finding resources that will enhance the quality of life for you or a loved one. I'd just like to close with a quote from Henry Ford. He said, "When everything seems to be going against you, remember that the airplane takes off against the wind, not with it." So thank you again for your attendance. Thank you for those of you who joined us remotely. Are there any questions at this time?
Yeah, I have a question.
Yes.
About 2009, I got diagnosed with a rare lymphoma, and I had 2 years to live, supposedly 3 at the most. And I called to see if I could get Medicaid because my bills were so horrendous. I had Humana healthcare. They said I could only make $800 a month, and I couldn't get it.
Right.
So then I have had different episodes. I'm still alive, but I've had different episodes of things that have happened to me that have put me in intensive care. And this last one is that I can't, 18 months ago I woke up, I couldn't move my hands. I can't really move them really well. So I've been to about 5 different doctors. So my doctor has only one assistant. They have 1,700 patients. And I haven't seen my doctor for a year. I just see the assistant. And everybody is so overwhelmed. So I called to see if I could just get help in the house with, I didn't need, I'm pretty self-reliant and stubborn. I try to do things myself. And I called to see if I could get any help just moving, like furniture or cleaning. And she said to me, no, the only thing they do is help you dress yourself. And she said, sorry, but there's just nothing available. You'd have to pay if you needed help. So everywhere I've called so far, it's like you got to pay or you don't get it.
Right. Yeah. The question was that with health concerns, health expenses, finances have become very strained. The requests have been made of Medicaid and probably others to see about some type of assistance in the home that's affordable, or can be some type of payment assistance through Medicaid or some other service that might be made available, and it's been difficult to find. And that's not an uncommon thing. Like I say, basically as I mentioned early on, is that the homemaker services are intended to be short-term. So even if you get some type of thing through Medicaid, it may be a longer term through Medicaid, but it's going to be very limited as far as the number of hours that you see.
Really, if you're like when the lady called me about getting help in the house the first time, I was on the live by myself, and she said, can you dress yourself? And I said, yes, which I could dress myself. And she said, can you shower? And I said, yes. And she said, do you drive? Well, I do drive, but I wasn't then. And she said, well, you don't qualify. And I mean, everything that that I have asked for on the telephone, I don't qualify for. And yet, I've been in intensive care. My hospital bill, the last hospital bill, the two, were $500,000. I didn't pay them all, but I had to pay a percentage. And the insurance, maneuvered it down a little bit, and then I had to pay the 20%.
Right.
So just now, I mean, the last doctor gave me this cream, and it's $95 a tube for my thumbs, and the only alternative is surgery. And he said, you'll be very painful, and you won't be able to move your hands for 3 months. And so what am I going to do now? If I can't get any help, by calling, how does it work? So really, it's all about money. If you don't have the money, you don't get the help unless you're really dying.
Right. And again, the question still concerns payment for services in home, and it is a very limited service. Again, like I said, when I spoke about insurance and some of the in-home care, it's generally immediately following a hospitalization. It's for a short period of time. It's while the therapist thinks you're making improvement and it's doing something well, or it's short term for like homemaker services and like. Beyond that, then they consider it custodial care, and they say if you need custodial care and can't maintain, you really should be, and this is going to cost them more money, institutionalized, where someone can do all those things for you. That's going to cost them so much more money. So like I say, you're absolutely right. You're probably stuck in that terrible spot.
If you don't have credit cards, you forget it.
Yeah,
Because,
right.
I mean, like the medication, it's just really, they gave me, I have skin cancer too, and they gave me some medication which was $200 a tube.
Right.
And I didn't get it,
Right.
I just go without because, some of the medication is so expensive.
Right. And like I said, a lot of drug companies have medication assistance programs for the co-payment and everything. But again, if you are the person who's blessed to have insurance, you're the person who's blessed to not qualify for that program. Yeah. Yes.
In regards to that, I don't know if did you say you contacted Nevada Division of Aging Services?
They gave me, what happened was I asked my doctor, I said, I'm sure that I live in a low-income mobile home, and I said, I'm sure that there's people that have help, and she said, we'll put you in as an emergency, and that's when the woman called me and asked me, all they do is help you dress.
Yeah. Well.
It's a different program.
Yeah. Right. If you'd like, before you leave, we'll give you information on how to contact, which is probably what she's referring to, the ADRC, the aging.
I don't really want anybody
Right.
technically, but sometimes, when I'm trying to do something really hard, and I only have my 2 daughters here. My daughter works, and my other daughter is
Yeah. But you should take advantage of what resources are available for you. I don't think anyone intending for you to, financially strap yourself to spending more than you have and running up credit cards, and it's definitely not the intention that you do not receive or take your medication because you can't afford it. Let us give you some information before you go, okay? Yes?
In early June, we hit the donor poll, which has dropped us off because on paper, we can afford the medicine, but it's Namenda XR, which is 400. So right now, we're just with nothing.
Right.
Which I think would hinder the research that this, facility is conducting if we can't afford the medications that they want us to take.
Right. The question is referring to the donut, the gap in benefits.
Yes.
And the access to medicines that you'd receive under that. How do you afford to keep doing that? And like I said, it's definitely a problem that I have no answer for. Unfortunately, everybody is in that. It was a government mandated gap, so that everybody, when they hit that plateau, there's not too much to do. It happens to everybody that hits that donut hole, you know. So I mean, it's not affordable, especially for people on fixed incomes. It's the worst. Again, it's one of these things that hits the most affected people the hardest. So is it providing a benefit? You have to take it for what it's worth. So yes.
I have two questions actually. This resource guide that you passed out, I see it was updated in February. If I wanted to get updated ones in the future, where would I get it from?
There's a number of resources available on the website, and I cannot tell you how often they're updated. It's like that. It's probably has a date on it, but is it dated? That one, I'd have to look at it to see that one. But there's a number available, and like I said, this is something that I think that's good for the remote locations also. That if you go on, you can find area-specific resource where it's been combined like that, and you can get a directory of things. But how often but there's a number of them, like Southern Nevada Housing Authority puts out one that's very similar to that one also, that they try to encompass not just housing, but all different types of resources. So there's a number of methods.
A person in the community utilize your services, they have to be an MS patient?
I deal specifically with MS patients here at the clinic. Any other clinics would go to Samuel over here. So, yeah, any other patients or their families, you know, that have a situation that they run into are covered by our social services, or counseling services are all included. Yeah. Any remote questions? Yes.
The state of Nevada does have a senior RX program that will cover medications during the gap period. My husband is on extensive medications and he's in the gap, and there's absolutely no charge for those medications during that period until you go to the catastrophic phase.
Oh, that's good to know. So there's another program offered by the state that's called a...
The Nevada State Senior Disability Program. It's run out of Carson City.
A program out of Carson City, a senior resource program that helps fill that Medicaid gap for senior RS disability, RX for the prescriptions.
And they work in conjunction with your current insurance, with your RX insurance, and you pay a small monthly premium for that.
Yeah, so very good, thank you. If there's no other questions, I thank you. Yes, yes,
I'm sorry.
that's okay.
You mentioned that there were airlines that actually would help a patient transfer.
Right.
Are you familiar with any in particular that do that?
I know American United, and the question was, I'm sorry, is there in airport accommodations and airline accommodations are where are they available from? Most of the major airlines now offer that. Some of the smaller ones don't, because again, the people it's airline employees who are having to be trained to do appropriate and safe transfers. But almost all the major airlines now offer that. It started with about 5 or 6 a few years ago, but most of them now. And you can go to their... My suggestion is, once you find your ticket price that you can afford to pay, and you know that your airline, that go to their website, and on that will tell you what type of accommodations they can perform, just to verify that. Any other? And I thank you very much.
Thank you.